Welcome. Let's get started with a case study. At 3 months of age, a patient presented with his first bacterial infection. While this was a localized skin infection that got better with antibiotic treatment, a few weeks later, he was hospitalized for severely enlarged cervical lymph nodes and diagnosed with strep throat. At 6 months of age, the patient again developed a highly contagious skin infection that caused red sores on his face, known as impetigo. Soon after recovering, the patient had to be hospitalized for a lung infection and was diagnosed with pneumonia. By his second birthday, our patient had battled 2 more bouts of pneumonia and many localized infections of the skin, ear, nose, and throat. His doctor noticed that the patient rarely presented with inflammation in the area of infection or with fever. While all of this patient's bacterial infections so far have been localized and non-invasive, the patient is at risk for invasive bacterial disease, which is when severe bacterial infections spread to normally sterile fluids or tissues, such as the bloodstream, leading to sepsis, or to the brain and spinal cord, leading to meningitis, or to the joints, leading to chronic inflammation and arthritis. So why is this patient so susceptible to these recurrent, potentially life-threatening bacterial infections? Upon genetic testing, it is found that this patient has a myeloid differentiation factor, or MyD88 deficiency. MyD88 deficiency is an inherited disorder of the immune system. This patient's lack of functional MyD88 affects the innate immune response, which is the body's first defense against bacterial infection and other pathogens. MyD88 is a key downstream cytoplasmic adapter molecule that is necessary for signaling of most of the toll-like receptors. As you make your way through the lessons in this blog, you will learn what toll-like receptors, or TLRs, are, and how they activate innate immune responses, such as the initiation of inflammation to fight against infection. You will also learn about the ligands of the 10 known human toll-like receptors, the structures of the toll-like receptors, and where they are located in the cell. Finally, you will read about how toll-like receptors stimulate cytokine and chemokine production through the activation of various transcription factors, and you will finish by learning about the 4 downstream cytoplasmic adapter molecules that are necessary for TLR signaling, such as MyD88. Good luck!